Hi, everyone. My name is Chris Tamborini. I work at the Office of Retirement Policy at SSA. And before I say anything else, the views that I express today are my own and not of SSA or any federal agency. So first off, thanks for inviting me to discuss this paper. Poterba and Venti are two of the, this is like the best of the business in terms of looking at wealth accumulation, and particularly at late life. So I do welcome the opportunity to discuss this paper. So the paper's focus intersects with the long-standing questions about how health and wealth evolve over the retirement stage of the life course. It exploits HRS panel data to examine wealth change in a wave after the first onset of 8 health conditions and 3 intensive health care events. It computes also the probability of the onset of health problems from 65 until death. And it also computes the expected reduction in wealth of each health shock for 65 years and older over the remaining years of their life. So this paper is important for various reasons. Among others, there's a lot of policy and scholarly interest in the determinants of wealth dynamics in later life. In other words, what factors drive wealth change in late life? Very interesting question. As the HRS matures, I think we'll come to a better understanding. We'll be able to come to a better understanding of that question. Wealth not only helps finance consumption and retirement, but also provides a cushion against bad events. The water heater breaks. More importantly, in the health arena, the ability to cushion health shocks. There are substantial differences in wealth across social groups. Huge gaps, racial gaps in wealth, also by education level, lifetime earnings. That makes it a very interesting and important topic. And furthermore, given the changing pension landscape from a DB to a DC plans, wealth trajectories, particularly among future cohorts in later life, may become increasingly heterogeneous. And that also kind of generates interest in this topic. Furthermore, population aging, increased life expectancy, and increasing health costs raise concerns about the financial consequences of late life health shocks. To quote the authors, how much savings do I need to prepare for late life health shocks? And this paper gets to that question. In terms of some of the policy-related concerns or importance, the relationship between late life health shocks and the wealth cost following those health shocks have potential, and I would want to underline potential implications for a range of policy outcomes: retirement planning and savings, retirement timing and post-retirement work, Social Security claiming, Social Security income to household income, eligibility for Medicaid and other means-tested programs, particularly if the household has most of their wealth portfolio as financial assets rather than housing wealth, for example. Has important implications for the family. Wealth shocks could, wealth cost of health shocks could influence post-retirement living arrangements, moving back in with the kids, so to speak, and also influences which is what the authors also mentioned, transfers to children and grandchildren, could influence consumption and debt, poverty, and even mortality. There is some research suggesting that lifetime wealth conditions can influence mortality rates. So the paper's key findings. One, and I think this to me is what was the main takeaway to me at least, it shines light on the variation in short-run health cost of specific health shocks in later life, right? A lot of times when I think of the health shocks and what are the cost of a health condition or decline, I think about it in general, self-reported health. But this paper is really keen and very sharp in kind of showing that there are these different health diagnoses or conditions that onset in late life, first onset, and they each have very, very distinct health costs. So some health costs some health shocks are costly: lung disease, stroke, nursing home care, which the authors frame as an intensive health care event, not necessarily a condition, and also spousal death. However, there are no significant effects out of 6 out of the 8 health conditions that the authors look at, for example, diabetes and heart attack. Furthermore, it wasn't presented earlier, but they do actually break out the results by whether someone has supplemental private insurance, which I thought was a very interesting approach. So if you have supplemental insurance or Medigap versus not, and then they look at whether the wealth cost of the health shock varies by whether you have supplemental insurance and also long-term care coverage. They find mixed results, surprisingly. Supplemental insurance moderates wealth depletion for some, as you might expect, right? Cancer, but not all conditions. Stroke, for example, the results were very similar between individuals or households that had supplemental insurance and those that did not. It wasn't really presented earlier, but they also show in the paper mixed patterns across the gender and marital groups. The percentage decline was deepest, percentage decline, not absolute dollar change, was the deepest for women, 11% single, and I think I got that wrong because I read the abstract. It's 22% for single women. So the deepest for single women, I should say, which should be 22%. I have 11% on the slide. Furthermore, which was not presented, but I thought very interesting, the authors analyzed this in terms of not just the decline in wealth, but how wealth components change. So they show the drawdown in wealth is occurring across multiple components of wealth for some conditions, such as stroke, and I found that very interesting. So in other words, what type of wealth do people tap into when they experience a health shock in late life? I was particularly interested in noting that for some, like stroke, health, home equity seemed to be tapped into, and that, to me, was interesting to empirically show that some folks are actually tapping into their home equity or housing wealth to at least, following a health shock. The paper also estimates the expected lifetime wealth cost of later life health, and I think this is the pre-discounted rate, but and to quote the authors, individuals age 65 could expect between $30,000 and $90,000 of health-related drawdowns of wealth depending on their gender and marital status. So some discussion points. First, I think the results are consistent with the idea that retirement planning, particularly in a DC world, entails thinking about healthcare cost, right? And maybe the condition in which we think we might, or the condition in which we might have. Secondly, I want to mention what's really interesting perhaps for future work among someone, not necessarily the authors, but identifying, I thought it was, this paper kind of generated this idea, identifying mediating channels linking the wealth changes to the particular health shocks would be informative. So for example, what I'm trying to get at here is what is driving the change in wealth following the health shock? Is it non-medical cost or indirect cost associated with the condition? Is it something to do about the insurance? Maybe the insurance, supplemental insurance or Medicare covers a certain condition better than it covers others? Or is it about having private supplemental insurance or not? Furthermore, and I know Poterba and Venti have some papers on this, prior papers, the role of Social Security and annuitized pension income in defraying the cost. And so the idea is that the higher annuitized income you have in late life, the softer the wealth consequence of a health shock, because you can use your kind of income to defray those costs. And also transfers to children. For example, it was noted in the paper that cancer diagnosis, there's been some prior research noting that cancer diagnosis might generate or influence higher wealth households to start giving money to their children. And that would of course influence wealth observations. Another point was to consider the heterogeneity and the impact. So, something that came to my mind is how does the slope of the wealth drawdown vary by initial wealth level, which the presentation did get to a little bit. Also, maybe this is kind of the demographer in me, but how does the impact maybe vary by social demographic groups? I can imagine maybe separate regressions, difference of difference on not just by gender and marital status groups, but retired, not retired, age groups, educational subgroups, and also the prevalence. How does the impact of the health shock on wealth vary by people who have multiple conditions or comorbidity versus those that do not? Moving on, how might we think about the role of the earlier life health and wealth conditions in the causal sequencing? Lifetime wealth conditions have a cumulative impact on later life health, but the challenge of, this is a challenging topic because it kind of goes both ways. Health during work life can also affect later life wealth. But anyway, just in general, might we think about these later life processes and how might we connect them to earlier life? When I say earlier life, I mean not just childhood, but also adult working life. Also, measurement of wealth, kind of a separate topic. The analysis here looks at, if I'm understanding it correctly, absolute dollar changes, real dollar changes, but I was also interested in the percent change between waves. That I think would show perhaps different kinds of results. Stratified models by initial wealth, we've discussed that, and logged, are the results sensitive to logged wealth? Following health, so a longer time frame might also be informative. Analysis looks at short run changes and some policy relevant considerations. To what extent do wealth changes, these are some questions I had that were inspired by the paper really. To what extent do wealth changes following late life health shocks alter retirement timing? How do lower wealth households respond to later life health shocks? It's kind of a separate topic, but interesting. Do health shocks increase Medicare eligibility through wealth depletion, particularly at advanced older ages, and among which households, and those might be the households that hold financial assets in particular? Thank you.